The labor dispute involving Chief Executive Officer of the Linden Hospital Complex, Rudolph Small, the Ministry of Health, and the Guyana Public Service Union has over time engaged the attention of the Ministry of Labor. Chief Labor Officer Charles Ogle divulged to Nightly News recently that after engaging the union and the Health Ministry, he has concluded that both parties had failed to formally meet to discuss the issue from an employee-to-employer perspective, thus breaching the grievance procedure.
Ministry intervened with the intention of solving the matter, but then we realized that the parties did not have no meeting at bilateral. So before any matter should come to conciliation, it should exhaust the grievance procedures. So we advise that the parties, and they agree, that they should have a meeting. So that's where it's at.
Ogle noted that no timeline was given for the bilateral meeting. However, he made it pellucid that the Ministry of Labor will not be able to take any further actions unless the meeting is conducted. According to the labor laws, if no resolution is arrived at the level of the bilateral meeting, the Minister of Labor can exercise several powers, which includes inquiring into the causes and circumstances of the contention, taking expedient steps to promote a settlement of the disagreement, or referring the matter to arbitration. The Guyana Public Service Union claims that after several failed attempts to engage Minister of Health Dr. Frank Anthony on the matter, it contacted Permanent Secretary of the Ministry of Health Malcolm Watkins, who suggested that the workers involved in the protest actions at the Linden Hospital complex should resume duties before the parties can meet. The union said the matter came to a halt since it rejected Watkins' advice, citing that Small's recent actions were an assault on the integrity of the healthcare staff and that they should not be forced to work under his leadership. The health minister is on record saying at a recent virtual press conference that the strike action taken by healthcare providers at the hospital since March 1st is illegal. However, when asked whether this is true, the chief labor officer would only say there lies a freedom to strike.
There is a freedom to strike. The Constitution guarantees a freedom to strike.
While it is unclear whether there were any disciplinary actions meted out to Small after his distasteful comments about the nurses at the hospital were publicized, evidence shows that he was served a letter of dismissal by Watkins on March 1st and was reinstated on March 3rd. He confessed to telling a regional reporter that nurses at the institution would sign in for their respective shifts, then leave the hospital to sleep with extramarital lovers. He subsequently issued 2 apologies to the affected staff, but the union and the staff are resolute in their position that he should be removed from the healthcare system. At a recent press conference, the Guyana Public Service Union had alleged victimization against the staffers who had participated in the protest action. According to the union, 10 healthcare providers at the hospital received significant reductions in their salary for the month of March. The deduction, according to the union, was because of claims by the hospital's administration that the staff had been absent from duties in 2018. Temika Rodney reporting for the HGP Nightly News.